All right, welcome back to the deep dive. I was thinking about our topic today, and it's something that I think, a lot of people either experience themselves or, know someone really close to them who does. We're diving into anxiety.
Yeah.
It can show up in so many ways, right? Like you get those racing thoughts before a big presentation at work. Maybe you feel like, like there's a tightness in your chest when things get really stressful.
Mm-hmm.
Or even just kind of this, general feeling of unease that just kind of hangs around. I mean, anxiety is just so common.
Yeah, it's definitely part of the human experience.
It really is. And in this deep dive, we're going to focus on the medications that are designed to help manage those feelings. We call them anxiolytics.
Exactly.
So think of this, as your guide, your personal guide to really understanding these meds. We've gone through a ton of research, and we're going to break down how these medications actually work on your brain. We'll talk about when they might be the right choice for somebody, and importantly, what makes each one unique? What are the differences? What sets them apart? Our goal here is to give you a clear picture of this whole category of drugs without, getting too lost in the weeds, without getting too technical, overwhelming you with jargon.
For sure.
We've gathered a lot of information, so we'll be breaking things down into three main categories today. We'll start with benzodiazepines.
Yeah.
I think a lot of people are probably familiar with at least the name. Then we'll get into barbiturates. They have a much longer history.
Interesting group, yeah.
Yeah, and finally, we'll explore some other medications that are out there that are used to help manage anxiety that maybe don't fit neatly into those first two categories.
Sound good.
Sounds great.
Okay, let's unpack this then, starting with benzodiazepines. Now, these are often the first choice for a lot of doctors when it comes to treating anxiety.
And the interesting thing about them is how they work, how they actually have that calming effect. They primarily target something in your brain called GABA A receptors. Now, GABA, and that stands for gamma aminobutyric acid. It's a mouthful.
Yeah, I was going to say.
But it is basically your brain's natural slowdown signal. It's a major inhibitory neurotransmitter.
So it's kind of like hitting the brakes.
Exactly. So when a benzodiazepine binds to this GABA receptor, it doesn't activate it directly, but it really enhances that calming effect of GABA. It's like turning up the volume on that slowdown signal. And specifically what it does, it increases the frequency of chloride channel openings.
Okay, so I'm picturing like our nerve cells are constantly sending signals and GABA is telling them to slow down.
Right.
The benzodiazepines just come in and they crank that signal way up. So it's open, open, open. More of that chloride, those chloride ions getting into the nerve cell.
Yeah.
So what happens when those ions get in?
So when those chloride ions rush into the nerve cell, it leads to what's called hyperpolarization. And it's kind of like flipping a switch on the nerve cell to off, or at least way down low.
Okay.
And because of that, it becomes much harder for the cell to fire off those signals. So this decrease in that neurotransmission, that's how benzodiazepines help reduce those feelings of anxiety.
That makes a lot of sense. So practically speaking, when might a doctor prescribe a benzodiazepine? Like what situations are they typically used for?
Well, as we mentioned, anxiety disorders are a primary reason.
Yeah.
They can be very effective at easing the symptoms, even those intense feelings of anxiety that come with panic disorder, for instance. But, and this is a huge point, their use is generally recommended for short periods because of the risk of developing dependence.
Right, yeah.
And for longer-term anxiety management, doctors often prefer those benzodiazepines that stay in your system a bit longer, like clonazepam, lorazepam, or diazepam.
So the longer half-life basically means it's sticking around longer. It's providing more consistent relief. And maybe you don't get those peaks and troughs that can happen with the shorter acting ones. So finding that balance, giving relief when it's needed, but minimizing those potential issues down the road.
Exactly.
Now, what about sleep? I know a lot of people struggle with getting a good night's sleep.
Definitely.
And I know that sometimes medication is an option for that.
Right.
So where do benzodiazepines fit into that?
Yeah, so certain benzodiazepines are used as sleep aids. We call them hypnotics.
Okay.
And it's the ones that have an intermediate duration of action, like temazepam, or the shorter acting ones like trazodone.
Gotcha.
They're the ones commonly prescribed for sleep disorders.
Okay.
Now, you probably won't hear much about flurazepam anymore.
Okay.
It's a long-acting benzodiazepine. And it was used for sleep, but not so much anymore because those effects can last well into the next day. So you're feeling drowsy.
Yeah, you don't want that, right?
Yeah.
Groggy all day.
No, not ideal.
Not ideal at all. Now, I remember reading about amnesia and how it was connected to benzodiazepines, especially during medical procedures.
Yes. It's a really interesting application. So the shorter-acting benzodiazepines, particularly midazolam, they're often used before procedures that can cause anxiety, like an endoscopy or even dental work.
Oh, okay.
It's what we call conscious sedation. So
Mm.
you're not completely unconscious, like under general anesthesia.
Right.
You can still respond if somebody asks you a question, but you're very relaxed, and most likely you won't remember the procedure afterward.
Oh, that's wild. It reminds me of that story I told you about when I had that dental work done. I felt like I was waiting forever for a blanket, but it was really just a few seconds. Time got all warped, and I didn't remember anything afterwards. Such a weird feeling.
It really is,
It
yeah.
really illustrates that effect. So it's not just anxiety and sleep, right? And benzodiazepines are also used in managing seizures.
Absolutely. Clonazepam is used as what we call an adjunctive therapy. It's used along with other medications for certain types of seizures. While lorazepam and diazepam, they're first-line treatments for something called status epilepticus, which is essentially a prolonged seizure that needs immediate medical attention.
So it's a pretty diverse range of uses.
Hmm?
I also remember seeing something about their use in muscular disorders.
Yes, so diazepam can be helpful in treating those skeletal muscle spasms. It can provide relief from muscle tightness and pain.
Okay. So we talked about what they do and when they might be prescribed, but how long do they typically stay in your system? I understand there are different types based on how long their effects last.
Right. The pharmacokinetics, or how our body processes the drug, is key. And specifically, we look at the half-lives of benzodiazepines to determine their therapeutic use. They're generally categorized as short-acting, intermediate-acting, and long-acting. And this duration of action, that really influences which specific medication might be chosen for a particular condition.
So it's all about tailoring it to the specific need. Now, of course, like any medication, there are potential side effects. What are some of the ones people should be aware of?
The most common side effects, you might feel drowsy, confused,
Okay.
and at higher doses, you might experience something called ataxia, which is basically a lack of coordination.
Okay.
It can make things like driving unsafe. Cognitive impairment is also a possibility. And it's important to note that triazolam, that particular benzodiazepine, has been associated with some specific issues, like you build up a tolerance to it really quickly. You can have early morning insomnia, daytime anxiety, even amnesia and confusion.
So not ideal. Are there any other considerations when it comes to using benzodiazepines?
Yeah, a couple of things to keep in mind.
Right.
You got to use them carefully if you have liver disease, because your liver is what processes them. They're also generally awaited in individuals with a condition called acute angle closure glaucoma. And this is really important. Alcohol and other CNS depressants, like opioids or even some over-the-counter sleep aids, they can amplify those sedative effects of benzodiazepines.
Oh, so that combination can be dangerous.
Very dangerous, yes. On a slightly more reassuring note, an overdose with benzodiazepines alone, it's rarely fatal unless it's combined with other depressants, like alcohol.
Okay, that's a really important distinction. Now, just to keep all these different benzodiazepines straight in our heads, could we go through some of the common ones and maybe categorize them based on how long they last?
Absolutely. A good way to remember the short-acting benzodiazepines is with the mnemonic ATOM, alprazolam, triazolam, oxazepam, and midazolam.
Hey, Tom. Okay, got it.
Then there's the intermediate-acting temazepam. And finally, the long-acting ones include clonazepam, lorazepam, diazepam, and flurazepam.
All right, so ATOM for the short acting. Okay, I think I can remember that. Now let's move on to barbiturates. I know they were used more frequently in the past, but they still have some uses today, right?
That's right. Barbiturates, they're similar to benzodiazepines in that they also interact with those GABA A receptors we talked about. They enhance that calming effect of GABA,
Okay.
but their binding site on the receptor is different. And instead of increasing the frequency of those chloride channel openings, they prolong the duration of the opening.
Oh, okay, so it stays open longer.
Exactly. And what's also interesting and important to know is that barbiturates, they can block those excitatory glutamate receptors in the brain.
Okay.
So it's a broader action, generally making them more potent, but also they come with more significant side effects compared to benzodiazepines. So it's a similar but more forceful way of calming things down in the brain.
Yeah.
And that means potentially, bigger consequences.
Yeah, higher risk. So how are barbiturates used therapeutically these days?
Well, their effects on your central nervous system really depend on the dose.
Okay.
At lower doses, they can cause sedation, have a calming effect. But as the dose increases, they can induce hypnosis, then anesthesia, and ultimately even coma and death.
So that's a pretty fine line between a therapeutic dose and a dangerous one.
It is. That very narrow margin is a major reason why their use is limited nowadays.
Makes sense. What about specific medical uses? I know I've heard about them being used in anesthesia and for seizures.
Right. So ultra-short-acting barbiturates like thiopental, they're still used intravenously in some very specific situations to induce anesthesia. And then we have phenobarbital. It's used for long-term management of certain types of seizures, specifically tonic-clonic seizures.
Okay.
And it can also be used to treat status epilepticus that hasn't responded to other treatments.
So they still have their place in some critical, more severe situations.
They do.
What about using them for more general anxiety or insomnia? I mean, I know they were used for that in the past.
Yeah, historically, they were used as mild sedatives and to help with sleep.
Right.
However, this is no longer really accepted practice, and that's because of their significant adverse effects and the fact that you can develop tolerance to them rather quickly. The risks, they just outweigh the benefits, especially with other safer alternatives available.
Right. You mentioned the side effects, and it sounds like they could be pretty problematic. What are some of the main ones to be aware of?
So barbiturates can cause a lot of drowsiness, difficulty concentrating, mental and physical sluggishness, and their depressant effects on the central nervous system. Remember, they synergize with alcohol.
Oh, right.
So that creates a really dangerous combination. Another thing is the hangover effect. Even when used as a sleep aid, they can leave you feeling impaired for many hours after you wake up. Nausea and dizziness are also possible.
Oh, man. And, I remember reading about how barbiturates can affect other medications.
Yeah, this is super important to understand. They're potent inducers of what we call cytochrome P450 liver enzymes. You can think of these enzymes as your body's way of breaking down medications. And barbiturates essentially make this process much faster for many other drugs.
Oh, so they speed it up.
They do, yeah.
So it could make those other medications less effective.
Potentially, yes. And that's a big deal because it can lead to significant drug interactions.
Right.
For example, if you were taking a blood thinner, a barbiturate could cause your body to break down that blood thinner much faster, making it less effective at preventing blood clots.
Wow.
They're also not safe for patients with a rare condition called acute intermittent porphyria, and it's really crucial to understand that abruptly stopping barbiturates can lead to very severe withdrawal symptoms. Things like tremors, anxiety, weakness, nausea, vomiting, seizures, delirium, and even cardiac arrest. And overdosing is incredibly serious and can result in severe respiratory and cardiovascular depression, potentially leading to death.
So yeah, that's a really stark difference compared to benzodiazepines in terms of the risks involved.
Yes, it is.
Now, just for clarity's sake, could we go through some of the common barbiturates and categorize them by their duration of action like we did with benzodiazepines?
Sure. We have ultra-short-acting thiopental, short-acting secobarbital and phenobarbital, intermediate-acting amobarbital, and long-acting phenobarbital and mephobarbital. You might notice that phenobarbital shows up in both short and long-acting categories.
Yeah.
That's because its duration of action can vary quite a bit depending on the formulation and individual factors.
Gotcha. All right, so that really highlights why barbiturates are generally saved for those very specific situations. So that brings us to our last category, the other medications that are out there to manage anxiety. And here we see a bit more variety in how these drugs actually work.
Definitely. We're moving beyond the drugs that primarily target that GABA system, and an important group here is antidepressants, specifically the SSRIs like acetylpram and paroxetine, and the SNRIs like venlafaxine and duloxetine.
Right.
You probably mainly associate these with treating depression, but they're also very effective in managing chronic anxiety disorders. And they're often preferred for those more persistent anxieties, like generalized anxiety disorder or social anxiety disorder, where the goal is long-term symptom management, not necessarily immediate relief.
Right.
They can be used alone, but sometimes they're initially prescribed with a low dose of a benzodiazepine to provide that quicker relief while the antidepressant takes effect.
Kind of bridges that gap.
It does, yeah. But it's important to remember that antidepressants, they typically have a slower onset of action, and they're not meant for those short-term, as-needed treatment of acute anxiety.
So it's more about long-term, consistent management. Now, what about buspirone? I've heard that mentioned as an anxiety medication, and I think it works a little differently.
It does, yeah. Buspirone is a really interesting option.
Okay.
It has a high affinity for serotonin 5-HT1A receptors and a weaker affinity for 5-HT2 receptors. It also acts as a weak antagonist on dopamine D2
Right.
receptors. But, and this is a key difference from benzodiazepines, despite some similarities in their chemical structure, it has no direct effect on those GABA receptors.
So it's a completely different pathway.
Completely different, yeah. And because of this, buspirone doesn't have the anticonvulsant or muscle relaxant properties of benzodiazepines. So if you're worried about the sedative side effects or the potential for dependence with other anxiety meds, buspirone might be something to discuss with your doctor.
Yeah,
It offers a different approach.
definitely. So it's targeting anxiety through a whole different set of chemical messengers.
It is.
So what are the pros and cons of buspirone then?
Well, a big advantage is its low frequency of adverse effects, and the ones that are most common are generally pretty mild.
Okay.
Things like headache, dizziness, nervousness, nausea, and lightheadedness. Sedation and cognitive impairment are minimal compared to benzodiazepines.
Mhm.
And importantly, it has a low potential for dependence.
Right, which is a huge benefit for a lot of people.
It is.
Now, what about zolpidem and zaleplon? I know those are often prescribed for sleep.
Yes, you're right. Zolpidem is a hypnotic medication. Now, it's not structurally related to benzodiazepines,
Okay.
but it selectively binds to a specific subtype of the benzodiazepine receptor called the BZ1 subtype.
Okay.
And this is interesting. This specific targeting allows zolpidem to mainly induce sleep,
Okay.
but it doesn't have the same effects on anxiety or muscle relaxation that you see with benzodiazepines.
Oh, interesting.
It usually provides a hypnotic effect for about 5 hours. Common side effects can include nightmares, agitation, anterograde amnesia, which is difficulty forming new memories.
Oh, wow.
Also headache, GI upset, dizziness, and daytime drowsiness.
So it's really honed in on that sleep aspect.
It is, yeah.
And then what about zaleplon?
Zaleplon's similar to zolpidem in that it also targets those benzodiazepine receptors to induce sleep, but it generally causes fewer lingering effects on your motor skills and cognitive function the next day.
Oh,
And that's probably because it's eliminated from your body pretty quickly. Its half-life is only about an hour.
wow, that's short.
It is. And it's also metabolized by a different enzyme in the liver,
Mhm.
CYP3A4. So it's a shorter acting option that might be better if you're worried about that grogginess the next day.
Makes sense.
Yeah.
Okay, I think that gives us a really great overview of all the different types of medications that are used to manage anxiety and sleep issues.
Yeah, it's a lot of information, but it's important to break it down.
It really is.
Yeah.
So to summarize, we talked about benzodiazepines, which enhance the effects of GABA. They're great for acute anxiety, but they do come with that risk of dependence, and they have those varying durations of action. Then we've got barbiturates, which also affect GABA, but in a much more potent way.
Mm.
And they also block those glutamate receptors. And that leads to some pretty significant risks and potential drug interactions,
Right.
which is why we don't see them used as much these days. And then we moved into those other options, SSRIs and SNRIs, which target serotonin and norepinephrine, and are more geared towards that long-term management of chronic anxiety.
Exactly.
Buspirone, which focuses on serotonin and dopamine without touching that GABA system
Mm-hmm.
and has a lower side effect profile.
Mm-hmm.
And then we ended with zolpidem and zaleplon, which selectively hit those benzodiazepine receptors specifically to help with sleep.
Yeah.
And they both have different durations of action and different potentials for those lingering effects the next day. It's really clear that understanding these differences is so important for anybody who's considering taking these medications, or maybe already is.
Yeah, it's crucial.
It's not one size fits all, right?
No.
And the best choice really depends on what type of anxiety you're experiencing, whether you need help right now or you're looking for something long-term to manage those symptoms. And it also depends on, your overall health and any risk factors you might have.
Absolutely.
And, thinking about all of this brings up something else, something important for our listeners to consider.
Oh, sure.
We're seeing more and more focus on anxiety treatments that might have fewer side effects, a lower risk of dependence.
Right.
And as those treatments evolve, it's worth taking a moment to think about, what's the balance between getting that immediate relief from anxiety and really developing sustainable long-term strategies
Right.
for managing your well-being.
Exactly. And that's the key, isn't it? Finding that balance between managing those acute symptoms and having a plan for the long haul.
It really is. Hopefully this deep dive has given our listeners some things to think about,
I hope so.
and maybe even encourage them to look into some other resources or even talk to their healthcare provider about which approach might be best for them.
Yeah, that's the goal.
All right. Well, I think that's a good place to wrap things up for today.
Sounds good.
We'll be back next time with another deep dive.